Thank you for taking time to watch the video. What we're hoping to accomplish through this is to communicate a new process that we have in order for the therapy and nursing to communicate on all of our skilled residents. As you know, on the 3rd floor and the 5th floor, we have care cards. The care cards give the nursing staff directions and information about what that person is care planned for, what level of care and how much care each person needs. We can't do that with the skilled patient on the 4th floor because they change way too fast, and we would be updating those papers constantly and they'd be out of compliance, and we know that. We want to be able to give the care that they require and encourage them to do what they can do so that they can get better quicker and go home. And the sooner they get better, the lighter the load is for you as the nursing staff. So we've developed a way to communicate, and we're hoping that each of you will pay attention to it and start using this communication. Our goal is to have it up and running on March 21st. But here, let me talk to you about how to use this communication board and why it's important. This is our communication board. You see it on all of the rooms on the 4th floor. The one across from the bottom of the bed is associated with that bed. So as you can see, there's 5 areas that we always document on: transportation, dressing, ambulation, toileting, and locomotion. Over here is the number of magnets for each person. Over here, as it says right now, this directions will not be in the room. This is just for purpose of teaching right now. So 0 magnets is going to be independent. 1 magnet means they're supervised. 2 magnet means they're limited assist. 3 magnet means they're an extensive assist. And 4 magnets means they're a total assist. So the greater number of magnets that is on this side is the more amount of care that the patient is going to qualify. So let's take a couple of these and we'll put them back over here. So right now, this person has 3 magnets. So if you look at it over here, they're an extensive assist. For dressing, they're a limited assist. For ambulation, they're a limited assist. For toileting, they're a limited assist. And locomotion, they're an extensive assist. Now, as therapy works with these guys, they're going to be changing these magnets. So somebody they've been working with now, instead of an extensive assist, therapy, please, only therapy will move the magnets on skilled patients. Therapy moves the magnet to the holding side, and now it's 2 magnets, which means this person now is a limited assist. They'll do the same with all the way down. Dressing, the person is getting better, doing more for themselves. They only need supervision, so now they only have 1 magnet for supervision. Toileting, the person still is a little bit harder with toileting. They still need more help, or the person had a fall and now they can't toilet, so now they're going to bring extra over. So now this person is an extensive assist with 3 magnets. So therapy will be guiding this because they're the ones giving the therapy in judging in what they can do and what they can't do. So it's really important for the CNAs and the nursing to know what these magnets mean and for what. The other thing behind there is, say that you've got a limited assist, limited assist all the way down, but yet the patient, and let's see, and supervision with transportation, dressing, and ambulation, still a limited assist with toileting, and we don't want them really going out on their own, but the patient is telling you as the aide, oh, I can't do that, I can't do that, you have to help me, I can't do that. Now you have a goal that you can point to this and says, no, right up here, the therapist says you're just supervision, so I'm just kind of here to make sure that you can get this done. Therapy are not going to change these magnets until they consecutively for 3 times in a row can perform this duty for the therapist. Because sometimes they're having a real good day, but that's not every day. And we don't want to set you in the resident up that you're failing. The therapist may say today they were a supervision, but guess what? They're really a limited assist because they can't do it 3 consecutive days in a row. So you guys are still doing limited assist. But it gives you something to point to and say, no, with transfers, you know what, I'm just here to watch you. I don't need to pick you up. I don't need to move you over. Or with dressing, I really, you're a limited assist. I don't need to be putting your arms through. I don't need to be buttoning your buttons. This is what therapist says you can do, and you can encourage them to do that. Sometimes it's a little bit hard. And we know that because there are some residents, and I'm sorry, there are some residents that want you to do more for them, and their attitude is, I'm here for you to do it. But they're not here for you to do it. They're here to get better. So we need to encourage them to do it. Now, for some reason, that person is not a limited assist, and you have to do more for them. Toileting, they're not a limited, because you are actually pulling their pants up and attaching their briefs, or fixing their pants. That's an extensive. If you have to do that type of stuff, get a hold of the therapist. See Nasser, see Kelly. Nasser, as you know, is unit manager. Kelly's the director of rehab. Or pull the therapist in, because they may be doing a technique that you don't know of. They may be doing something different than what you're trying to do, and the person has learned a whole different way to do it. So talk to the therapist. And if the therapist comes in and says, oh, no, they really should be limited, and this is why, then you'll know. You can do that, okay? But therapists may come in and say, wow, they've had a decline. And you're the one that's going to recognize that, because you're our eyes on that floor. Always remember that. As CNAs, you're our eyes, you're the nurse's eyes, you're the doctor's eyes, and we really go by what you tell us. So it's important that you communicate with us if they're not fulfilling this level of care. Now, we've developed another tool to help you guys out, and this is basically the care card. Let me see if I can get that in. It's the CNA Skilled Rehab Care Card. Now, it's basically a census sheet. So on one side, it's got room, I think it's on this side, right over here on this side. It's on this side, it's room 1 through room 13, and on the other side, it's room 14 to 25. When you come in the morning, you pick this sheet up. It'll be at the nurse's station. You should do your rounds. Go in and see, check your residents real quick before you start your day. And when you go into the room, take a notice on what they have. See what they have. So like on this resident here, excuse me for trying to maneuver this, on this resident in here, transfers. Now this paper says each day the aide will fill in the required care as determined by the therapist and indicated on the whiteboard in each room. So when you go into that room, you see this person transportation is a 1. So you find your room, you put your resident's name, excuse me, I'm going to show you here. Put your resident's name here, and then you start putting their level of care. As we said, this person here is a level 1 for transportation. So what we want to do is over here under transportation, you want to put a 1. This person, if you look at the board, if you look at the board, is a 2. A 2 is limited assist. So you come over here under dressing and put the number 2, and so on down forth. For ambulation, a 1. For toileting, a 2. For locomotion, a 2. Or whatever number they happen to be. And then as you look across, you can see what level of care. I know, guys, I've done it. You have 10 patients, you have 12 patients, you have 8 patients, whatever the number of the patients you have, you don't always remember what you did for that patient. So when you take this paper to your documentation, and if it matches this, then you're all set. If it doesn't match, and say, okay, for today, this person for toileted needed extensive assist, they're not a 2, put a 3 here. But if you notice tomorrow you're putting a 3, the day after you're putting a 3, you need to let somebody know, because this person has had a change, or you and the therapist are not doing the same procedure for them to be able to be more independent with it. So if you have 8 patients, you don't want to use both sides because your patients are scattered out, I don't mind. Take this side, cross the room number off, put the room number you had, put the patient's name, and still use this paper. You can fold it in half, you can do whatever you need to do so that you have this paper for your communication when you go to document. That way your documentation and the therapy documentation are matching. Because if they don't match, when all of this paperwork goes to Medicare, Medicare could deny the claim, because therapy is saying one thing, nurses are saying another thing. It doesn't look like the patient's gotten any better. So Medicare could say, we're not paying you for all the work that you did. The other thing is, if you're doing what they should be doing, they should be getting better every day, it's going to lighten the load on you. And you are encouraging this person to do what they can do. Maybe they don't want to do it, maybe they're afraid of doing it, but you're encouraging them to do what they can do so that they get better quicker and they have a better quality of life. Okay? If you have any questions, please get a hold of Jessica or I. The goal is to start this on March 21st. We're doing the video today. Hopefully we'll get it up on YouTube tomorrow, probably Monday. Today's Friday, sorry guys. And you'll have the week to review it and everybody get used to it. And we'll start it on March 21st. Please, if you have any questions, again, this is our communication for the short-term rehab. Pick up your paper, document on your paper, so throughout the day you don't have to keep questioning what's going on. Or if you don't have your paper on you and you go into the room, it's easy. I go into the room and say, I always say to the resident, are you walking by yourself or do you have two people? Because as you know, I toilet them, I transfer them, but I don't know always their level of care. So this will help me and anybody else that goes into the room what their level of care is, and it will help you to provide that care, but also don't forget to be able to document to that level of care. Thanks a lot. I appreciate each and every one of you, and have any questions, please don't hesitate to get a hold of us. Bye.